And welcome back. Well, does your smile reflect who you are, or are you embarrassed to smile because of your teeth? Mini dental implants may be the answer.
And Dr. Brandt Bower is a dentist. He is back with more on his dental implants, which we're going to talk a little bit more on show as well this morning. Nice to see you again.
It's good to be here. We've had a tremendous response as a result of our exposure here on your program.
That's fantastic. We like hearing about that. One of the things that intrigues people are the mini dental implants, because they're really different from traditional dental implants, right?
Somewhat. If you look here, you'll see this is a traditional root form implant, and they're wider, like wider than 3 millimeters, and these mini implants, or these small diameter implants, are less than 3 millimeters.
So quite a bit smaller.
Yes, they are. And
but do they hold as well?
They do. They have two tremendous advantages. One, they're much, much less expensive, even 1/3 or 1/2 as expensive as traditional implants. And two, they're very, very non-invasive. We can literally, in less than an hour, put one of these implants into the patient's jaw and then fasten a tooth onto it, and they can walk out of the clinic smiling and laughing and talking and eating.
That's fantastic. Wow. And who's a candidate? Because oftentimes I know when you need implants, sometimes there's bone issues or you've lost a tooth for certain reasons, decay. Are you always a candidate for the mini implant?
We like to say if you have a chin and a cheek, then you're a candidate.
All right.
Yes, and so if you're missing any teeth, or you have dentures that go in and out of your mouth, then you would be a candidate, and we could replace those teeth with implants that would then be fixed in your mouth. For example, if a patient has a denture,
okay,
and no teeth at all, and the denture doesn't remain firm in their mouth, we can put the small diameter implants into the denture, then retrofit.
So those, just so I'm going to point out here, it's these small pieces right here, these small sort of like
the mini dental implants.
That go into the bone, into the jawbone,
and then we retrofit the denture with these rubber O-ring housings, and then the denture will snap on, and it will be firm in the mouth
and stay in place.
Do you take them in and out yourself then?
They can.
Okay.
But if they're missing a tooth and they decide they want a fixed tooth, or if they're missing several teeth and they decide they'd like to have that, cemented in, then we will make a prosthesis and put cement on it and cement it into the mouth, and then it won't come out.
So that's better if you have some existing teeth, right, and you want to fill in?
That's the way we usually do it, but if people are missing all of their teeth, we can put in more of the dental implants, and then we can get rid of all the pink and cement a roundhouse, as we call it, all 12 teeth.
Okay.
Now, to Tiffany's point, when she was asking about who's a good candidate for it, a lot of people are going to say, well, I've had some bone loss, or they've been told they have some bone loss. So, you know, your point about, you know, if you have a chin and whatever, so you can have significant bone loss and still take advantage of the mini dental implants?
Yes, you can. That's one of the advantages of the small diameter implants. We usually do not have to do bone grafting at all. We can find enough bone to put that mini dental implant into the mouth, and unlike the traditional root form implants where we have to first graft and then we have to wait for that to heal, and then we have to put the implant in, then we have to wait for that to heal and integrate, it could take a year. We generally can do it in less than a week, usually in a day or in an hour.
That's fantastic. Do people do it mainly for cosmetic or for functional reasons, or both, really?
Really both.
Yeah.
They are very aesthetic. They're very beautiful when we put them in. And of course, you can smile better, talk better, eat better. And so that's the functional portion of it.
What do people say to you after you do these implants? What kind of feedback do you get?
That actually gets me emotional when I think about that, because so often we will do these for patients and they just are amazed, and they give me a hug before they leave, and they come back and they say, oh, we're referring so-and-so and so-and-so to your office as a result of this. And so it's very gratifying. You know, remember, I retired once and got so depressed I had to come back. And
Yeah, because you probably love getting that kind of feedback from people, and you do free consultations. What's included in that?
We're running a special. In the past, we've always charged for the x-ray, but the consultation is usually an hour, and it's free. And now we're going to include a panelip's x-ray picture with that, so we can see if there's any other problems that exist in their mouth. And that's free. The other special is normally an implant and a crown in our office is $1,600.
Okay.
We're offering the special till September of only $1,200, $600 for the implant, $600 for the crown.
That's wonderful. And again, that free implant consultation with free x-rays as well. If you contact Dr. Brandt Bower, here's the information to do that and set up your appointment with him. Call 1-Tooth-or-Gum or visit them online at toothergum.com as well. And that's how you can reach Dr. Brandt Bower to talk to him about these mini implants. Thanks so much for being here again.
Thanks for having me.
Nice to see you. Thank you.